Yes. So, hello and welcome to Seven Sentinels. This is Grand Master Class, and I am Peter Simon with you. Today, we are conducting a speaking session, and here we have with us Simran Masih from North India. She is preparing for her nursing specific speaking task, and today's case is a role play is asthma. Asthma. Right. So this is the card here. Yeah, this is the patient's card. This is the patient's card. Yes. This is the patient's card. Parents card. Candidate's card. So I'll be using this card. And then this is the nurse's card. So yeah, till here it's enough. Yeah. So you have 3 minutes to prepare. I have already given you. So we are going straight ahead. But for the students who are watching the YouTube, this, let me keep it for 20 seconds. Right. So once you are ready, you can start, Simran.
Yes, sir. Good afternoon.
Good afternoon, nurse.
My name is Simran and I'm one of the registered nurses working in these children hospitals. How may I help you?
Yeah, I have come here regarding my daughter, nurse. She has been suffering from this problem for the last 1 hour. I have brought for her to you so that you can check her.
Okay, I really understand your concern. Don't worry about that. I'm here to help you. Before proceeding further, I would like to ask a couple of questions. Is that okay with you?
Yeah, definitely, nurse.
Okay, how may I address you?
You can call me Martha, Mrs. Martha.
Okay, Mrs. Martha. Is she experiencing any symptoms like wheezing, tightness?
Yeah, of course, you're right. I have brought here because she has this symptom. She has chest tightness, wheezing, and difficulty breathing. Okay, I want you to check her. And it was actually, she was running around in the garden when she started having difficulty breathing. The symptoms are less severe now than when they started. I haven't given her any medications as I wasn't sure what to give her. She has never had anything this bad before, nurse.
Okay, and could you please tell me about the duration of her symptoms?
It was almost for 1 hour she was experiencing this problem.
Okay, Mrs. Martha, is he anyone in your family who has asthma, enzyme, or fever?
Actually, nurse, my daughter is generally healthy. She hasn't been ill recently and she isn't taking any medication. Of course, my spouse had asthma as a child, but I don't think anyone else in the family has had asthma, hay fever, or eczema.
Okay, Miss Martha, thank you for answering my questions. It's helped me to understand the situation much better. I will clarify all your doubts step by step. Firstly, let me assure you that I already assessed her vitals and her vitals is in a normal range. So please don't need to be worried about that. Am I clear so far, Miss Martha?
Yeah, of course, nurse, that's absolutely clear.
And second step is assessment by the doctor. Doctor will come and assess her condition and prescribe some investigations for further making good diagnose. And after that, he will discuss about the treatment also. So how does sound, Mr. Mrs. Martha?
Yeah, actually, nurse, I'm not bothered about all these things. I know that my daughter has asthma, so I just want you to check and confirm that she has asthma because my spouse had asthma as a child.
Okay, your concern is reasonable, but let me assure you that please don't need to be worried about that because we have expert doctor and nurses who will tackle this situation, and for this he make a good diagnosis for her. So it is very difficulty to diagnose at earlier stages. So please don't need to be worried about that. Our expert is there. How's that sound?
Yeah, that's very fine, nurse. But I really hope I don't need to wait too long for my daughter to see the doctor.
Yes, your concern is reasonable, Miss Martha. If I'm in your stage, I feel the same. But don't worry about that. Doctor will come soon, uh, and uh, and he will prescribe some treatment like salbutamol inhaler, which is very good for her. So, and let I hardly request to you that you need to waiting in the room. So, can you wait here?
Okay, of course. I hope it will not be late, so I'll wait in the waiting hall so that my daughter can be seen by the doctor. Thank you very much, nurse.
Okay, Mrs. Martha, do you have any other concern?
That's very clear and obvious. Everything is fine. Thank you for your patience and kindness, nurse. I appreciate.
Yes, thank you so much, Mrs. Martha.
Yeah. That's very good. So, having done with the speaking session, let me give you some feedback. Yeah, you have some problems, of course, not some ordinary problems, but some serious problems. You have a bit of hesitation. You are in a bit of no confidence motion. You don't have that level of confidence. You are thinking that you are going for an examiner. You are thinking that you are a student. You are thinking that I'm a tiger or I'm a like a lamb going in front of the tiger. That is what you're feeling. I don't want that feeling anymore. I want you to know that you are the tiger and I am the lamb. I don't know English and you are the nurse. You know English very well. And you are the nurse. You know about medical knowledge and I don't know anything about medical. So I am zero and you are 100%. Maybe I know little 5 to 10%, but I don't know everything. So you are the person who is the authority over the subject. Then I don't know why are you feeling this no confidence motion. I don't like that one. So next time onwards, be confident because I'm just a patient. You have to look at me only as a patient and not as a teacher or an examiner. Remember that. I'm not even an
Yes,
interlocutor. I'm just a patient. So you have to feel that I'm a patient and you are a nurse and you know everything and I don't know everything, anything, and I need help and you are on the higher side. You are giving me help and I am receiving help. You are giving me help. You know everything and I don't know anything. You are the authority. I am the I'm going to follow. I'm just a patient. I don't know anything. I'm a humble, meek, and ordinary person. That is what you have to feel, and that is what you have to talk like. So you have to be confident from next step onwards. I'll give you another session later. If you are very obedient, I'll give you more sessions. And whenever I'm free, I'll just ring it up, and you can make one more speaking session. I have given you 17 cards. Any card you can speak, and all your videos will be posted in the Telegram, YouTube and Telegram, and the audios will be typed, printed, and given to you. The PDF will be given to you with the name Nurse Simran Masih, and then interlocutor grandmaster class. Okay, so
Yes, sir.
everything will be there. So you'll get a dialogue, everything, each and every mistake of yours will be pointed there. Then afterwards, I'll give you a feedback, real feedback. This is just feedback. That is evaluation, correction, and everything is there for your improvement. So even in the OET, they will not give you corrections. They just give you mark and correct and give you mark, but you don't know what the corrections are. But here you are going to know everything, right?
Yes,
Is
sir.
that fine,
Yes, sir.
Simran?
Yes, sir.
And next thing is fluency and accuracy. These are two things. Fluency means how fluent you are speaking without pauses, breaks, and breaks like this, pauses like this, without you don't know what to speak. Your hesitation here and there, and two times you repeated repetition. Everything will be pinpointed there in the evaluation and suggestions for improvement session. So that is second round. I'll give you afterwards. The more you are obedient and the more you are ready to learn and the more you are ready to do whatever I say, the more I will give you. So are you ready for all these sessions, dynamic activities?
Yes, sir.
Okay, fine. So we'll meet you again later. Thank you very much. Have a nice
Sure,
day.
sir.
Bye bye.
Thank you so much, sir.